Cardiac electrophysiology is a specialization in cardiology that deals with the heart and its electrical system and tries to identify patients at risk for arrhythmias or treat patients who have arrhythmias. The specialized training for an EP doctor involves an added year of training on top of a general cardiology fellowship. In that year, there is exposure to pacemakers, defibrillators, mapping and ablation procedures to treat arrhythmias, which there is a mandated year, but to actually get the broad exposure you need, you almost have to do 1.5 years to 2 years of training. Patients are usually referred to electrophysiologists either through a cardiologist or a primary care doctor who, in evaluating the patient's complaints, suspects that there may be an arrhythmia in the background. There are many procedures available once you determine that somebody has a heart rhythm disorder that range for treating slow heart rates, putting a pacemaker in, treating life-threatening heart rhythms with a defibrillator, and for some rhythms that are more just fast heart rates that make the patient uncomfortable, mapping procedures to identify where the abnormal electrical activity is and then either freezing or cauterizing that zone to affect cure of that rhythm. The recovery time for surgical procedures like pacemakers or defibrillators involve an overnight stay in the hospital and 4 weeks of inactivity using the limb on the side that the device is placed on that might delay somebody getting back to certain types of work. For mapping and ablation procedures where rhythms are fixed, it's again an overnight stay in the hospital and then 7 days of no heavy lifting and then back to normal activities. If you or someone you love is having issues with an irregular heartbeat, please contact Carolina Regional Heart Center at High Point Regional, 336-878-6888.